Good morning, everyone, and thank you for joining us today. My name is Erin. I'm a proud registered nurse and the provincial president of the Ontario Nurses Association. I'm here to tell you that Ontario's home care system is hanging by a thread. It is understaffed, unsafe for workers, and is being forced to rely on private agencies to fill some very big care gaps. Today, ONA begins bargaining with the Victorian Order of Nurses in Ontario. And our goal is to negotiate a new, decent contract for our members. This morning, you will hear from VON member Lorna Thompson, registered nurse, who will talk about her work and the challenges our members face on the front lines of home care. First, some facts that will put their tireless work into provincial perspective. Registered nurses working in home care are the lowest paid nurses in the province. These RNs, who are primarily women, are isolated and face many hardships and barriers as they care for Ontarians in their homes. Despite being the lowest paid, they experience an overwhelming amount of violence on the job. Over the past 2 years alone, more than 2,100 workplace violent incidents have occurred in home care. This is 5 times that of nurses in other healthcare sectors. And this is based on WSIB data. But we know the incidents are grossly underreported. This is unacceptable, and it would never be allowed in any other job. VON nurses travel to their clients' homes alone, regardless of location. They visit off-the-grid remote areas where there is often little to no cell service available. This means, in effect, home care nurses would have no way of contacting anyone for help should they find themselves in threatening or dangerous situations. Meanwhile, the employer schedules nurses to see clients back to back, even though they may live hours apart, asking nurses to do literally the impossible. They're on the road constantly, facing many other challenges, especially during wintertime, further risking their safety. And after years of facing so many workplace issues, poor pay, and the rising cost of living, many home care nurses are leaving their jobs. And no one can blame them for doing so. Why would you work under such conditions when jobs are available in sectors where nurses get paid enough to meet ends meet? Of course, without them, there is no home care. Home care services help people to remain in their home as they age and save our system money. In 2020, more than 82% of home care recipients said these services help them stay at home, preventing hospital visits or long-term care. Ontario's home care system must be supported, full stop. The Ford government must step up and fully fund home care. Doing so will benefit these nurses, their clients, and all of us. ONA and our 68,000 members stand shoulder to shoulder with our VON members. And today, as we prepare to bargain with the employer, we are united in our demand. We demand home care nurses be paid equal wages with hospital nurses. Unless the VON Board of Directors negotiates fair pay and improves benefits, there won't be anyone left to provide the services we need. So our message is clear. It is time for the VON Board of Directors and the Ford government to pay fair for home care. Next, I would like to invite VON member and ONA's VON Bargaining Negotiating Team Chair, Lorna Thompson, to speak. Lorna.
Good morning, everyone. I am very pleased to be here this morning. My name is Lorna Thompson. I am a very proud registered nurse, member of ONA, and chair of the negotiating team for the round of bargaining, now beginning with my employer and the Victorian Order of Nurses. I've been an RN for more than 40 years. 30 of them has been in the community, caring for people in their homes. When I first entered the community sector, nurses were paid competitive wages. Those wages were close to those of the nurses in the hospital sector. I have loved caring for people in their homes, using my education, experience, and skills as an RN to help my patients the best possible way. I have been privileged to be able to provide holistic care that I really do believe in, and I have been able to teach self-care while providing hands-on care. Unfortunately, over the past decade, our wages have fallen by 14%, while even as the cost of living kept rising. Not only are our wages lower, VON nurses face unacceptably heavy workloads. It is simply impossible for us to provide good care to 16 patients in a 7.5-hour shift. That includes our travel time between clients and, if we're lucky, a short break. While VON pays our travel costs, the mileage is far less than the actual cost to us. Mm-hmm. And we are paid for X many hours of work per day, no matter how long our workday is. And it is invariably very long indeed, leaving us unpaid for much time. Mm-hmm. As home care nurses, we work alone, often in parts of the province with no phone service, leaving us vulnerable to workplace violence. We could speak for hours about the incidents we have all faced, and we are, frankly, not safe on the job. To make ends meet, many of the nurses in the community are working 2 or more jobs to be able to afford necessities for their families. Others are heading for the exits for other sectors which pay more, in keeping with our education and skills. It is absolutely imperative that VON's bargaining team come to the table serious about reaching a better contract for us. It is time to pay fair for home care. There must be equal pay for equal work. Community care has been underfunded by the provincial government. That started years ago because of the introduction for profit home care corporations into our once non-profit sector. It has long been shown that greedy non-profit corporations do not have the same system. They cost us all. My message today is simple. Our government must fund fair wages and strong care for our communities. VON must respect and value those of us who are out there providing care, and they must pay fair for home care. Doing so will help retain community nurses and help recruit more of us. Thank you very much.
Next, thank you, Lorna. I would like to invite the President of the Ontario Federation of Labour, Laura Walton, to speak. Laura.
Thank you, Erin, and thank you, Lorna. Good morning. I am Laura Walton, the President of the Ontario Federation of Labour, representing 55 affiliated unions and over 1 million workers in Ontario. When I speak to workers and their families, I hear the same concerns. People are struggling with the rising cost of living. They're anxious about their jobs, their ability to keep up, and they are deeply worried about the state of our health care. Recently, the OFL conducted some polling, which confirmed what Ontarians are telling us. People want government dollars spent wisely. They want every public dollar reinvested into publicly funded, publicly delivered healthcare and not siphoned off for private profits. And when it comes to who they trust to protect and improve healthcare, the answer is clear. People in Ontario trust healthcare workers and their unions as the most trusted voice in this province, more trusted than politicians, the bosses, or the government itself. Ontarians know the state our healthcare is in. Overcrowded hospitals and long-term care homes, public health outbreaks, and more are making headlines every week. But the solution isn't just about building more hospital buildings or adding more beds. It's about investing in the people who provide the care. Without them, those buildings are just bricks with empty beds. And that's why we're here today, because healthcare is Ontarians' #1 priority. And unless we invest in the people who deliver it, Ontarians will not get the care they need. ONA members are demanding something simple: fair wages, fair pensions, fair benefits. These are nurses who travel into people's homes, provide specialized and highly skilled care. They are the ones that keep people out of our overcrowded hospitals and long-term care facilities. They are an essential part of our healthcare system. And yet, they are the lowest paid nurses in Ontario. Since the pandemic, their real wages have fallen by 8%. At the same time, the cost of groceries, rent, and everyday essentials has increased. And home care is more important than ever before. But nurses are leaving home care for better paying jobs. And without those nurses, there simply is no home care. We cannot separate the state of healthcare in this province from the conditions of work for the people who provide it. And let me be clear, VON home care nurses will not settle for the kind of betrayal we just saw in the hospital sector arbitration. The arbitration has left more than 60,000 hospital nurses further behind. It rejected their call for safe staffing levels and treated their safety on the job as an afterthought. It compared nurses' work to retail clerk and office workers rather than recognizing the critical life-saving care they provide. That decision was a setback for hospital nurses, but it also signals to other healthcare sectors still fighting for wage parity that employers and governments, they don't value you. ONA VON nurses are sending a different message today. They won't accept falling further behind, and they won't accept unsafe conditions. We joined the Ontario Nurses Association in calling on Premier Doug Ford and the Victorian Order of Nurses to commit to wage parity with hospital nurses and fair pensions and benefits to retain and recruit staff. Ontario's seniors population is expected to grow by 650,000 in the next 6 years. The demand for home care is about to surge. Without immediate action, our system will simply not be able to meet the demand. And so here's the choice. If healthcare is truly the province's top priority, as Ontarians say it is, then the bargaining table must deliver fairness to VON nurses. Fair bargaining means fair wages. Fair wages will deliver stable care. And that is what Ontarians and the workers who make our healthcare system run deserve. Fair wages and fair care is the only path forward. Thank you.
Thank you, Laura. Our final speaker is Wayne Gates, Ontario NDP member of Provincial Parliament for Niagara Falls and the opposition critic for long-term care, home care, and retirement homes. Wayne.
Yeah, thank you very much. First, I want to thank the incredible work that our nurses at VON and home care nurses across the province do every day. And let's be clear. I want to say this, but let's be clear. Home care is health care. And I could talk about what's in my notes, but I want to talk about what's really going on. As your critic for long-term care, your critic for retirement homes, and your critic for home care, I don't know anybody, any parent, grandparent, that is saying, I want to go stay in a long-term care facility. They want to stay at home. They want to be home being taken care of. They want to be with their family. In a lot of cases, the family is the VON, the nurse that comes in every single day. But what has the government done? They've changed the whole game. They decided that, no, we don't have to use VON nurses. We can go out and get agency nurses, and we can pay them billions and billions and billions of dollars. But that nurse isn't the same one that's going to show up the next day on a Tuesday and the Friday. They're going to get a different nurse. But with the VON, they become family. They know that patient. They know what they need. They know before they go into that house what they're going to have to do to make it a better day for that particular patient. So I'm saying to the Ford government, if you got billions of dollars for private agencies so corporations could get money on seniors, the less fortunate in our community, reinvest that money into home care. Put it into VON nurses. Pay them a fair wage. Pay them fair benefits. Pay them a fair pension. Do everything you can at the bargaining table to make sure they're being paid fairly so that VON will not only continue to do that job, but more people want to become a VON nurse, want to get more involved in home care, because home care is the future. If you want to fix long-term care, you got to fix home care. If you want to fix the retirement homes, you got to fix home care. Let's do everything we can. And I challenge anybody that's listening today, who doesn't love their mom, their dad, their grandparent, their aunt or uncle, and all they want for them is the best possible care. And the best possible care is going to be delivered by VON nurses every single day. They're going to be there for you. They're going to cry with you, by the way, when you're sick. That's what we have to do. So to the Ford government, get to the bargaining table. The VON corporation, get to the bargaining table and make sure that our VON nurses are being taken care of at the bargaining table by paying them a fair wage, fair benefits, and fair pensions. Thank you very much for allowing me to say a few words today. Appreciate it.
Thank you, Wayne. I guess that concludes, unless do you have any questions?
Sure. So how far off are we from, wage parity and pensions and benefits that would match the hospital?
Significant disparity, sometimes over $20 an hour difference between hospitals' wages and VON wages.
There's a big difference in the pension and benefits too?
Significant difference between that as well, okay. Yes.
So are you hopeful to make up, is it realistic to kind of expect matching? Or do you
Absolutely. I support matching. It's equal pay for equal work of equal value. That is what is happening here. And I don't think, if we look at before home care was privatized, VON, and Lorna probably can tell you this, I've heard this many times, VON wages were higher than the hospital sector.
When I started
yes.
work.
Do you want to speak about
yes,
that?
I'd like to speak about that, because when I came to VON, I had left hospital sector to come to VON to do holistic nursing. And patients will tell you that made the difference. Mm-hmm. Over a period of time, though, we saw the wages slide for work where we are educated in the same way. Mm-hmm. We have the same licensing, and we do absolutely the same work. I would even say our work sometimes become more critical because you're in a one-to-one. If you have an emergency, it's just you. We deserve the equal pay. We're demanding it, and we're not going to settle, not this time.
Well, what was it like when you first started your job compared to now?
It was a joy to come to work. I would have my workday prepared. My husband, the firefighter, called it going from one home to the other home. One Christmas morning, we were both going to work, and he said, "Look at the couple of idiots just smiling." And we're smiling because we're leaving one home to go to our other home. That's what my job was like. Now I'm going to a battlefield every day.
It feels completely different from
absolutely.
When you started. And Erin, I know the Ford government was put in, I think, $1 billion into home care 2 or 3 years ago. Do you know where are we now from that investment, and has it made any difference? Where's the money going?
Well, it's just gone to private companies, and it hasn't certainly gone to the workers. It's probably gone to the folks running these companies and the shareholders in these companies. It's absurd that nurses in this sector are relying on food banks. I've spoken about this many times. I've heard about it from my members. It continues. They're losing their homes that they live in. They're unable to pay their car payments or even the gas to get to see their clients in the community. So I don't know where their investment went, but it's certainly not to the workers and it's not to the patients in their homes.
Those are my questions.
Can I add one thing as well? It's not just about the wages for the nurses, but when you have a nurse doing 2 full-time jobs, she will probably have a couple of kids, an extended family. How does she do that in 24 hours? And the patients, what kind of care are we able to give our patients if we're totally exhausted?
Yes.
When a nurse gets a worksheet with 16 clients to work in a 7.5-hour day, how does she do that? We are traveling fair distances, no lunch, no time to catch your breath. Again, what kind of care are we giving our patients? So it's not just about the nurses, it's about our clients as well. We are seeing more and more seniors. I've never seen so many seniors on a case list as we are right now. While we are having the increased number of seniors, we're losing our nurses because of the wages we can't hire and we can't maintain. So where are we going with this? If this is not critical, I don't want to see what critical is. It has to end, and it has to end now. It's time.
Thank you, Lorna. No other questions? That concludes. Thank you.